good morning everyone. Welcome to the nervous system aspect of NUR 678. During this lecture, we're going to talk a little bit about the brain. We're going to talk about neuroanatomy, we're going to talk about neuroassessment, and then we're going to go into the differential diagnosis of different neurological disease processes. Okay? We're going to start with neuroanatomy because it's very important for you to understand neuroanatomy in order to understand neuroassessment and then depict neurological diagnoses. A lot of the pathological processes that occur in the brain corresponds to neuroanatomy. They're a basic symptomology that corresponds to where the lesion or where the disruption is in the brain. So if you understand neuroanatomy, a lot of times you can depict what's going on with your patient just by looking at what symptoms they come in with. Okay? So it's very important to have a basic understanding of neuroanatomy. Okay? So here we're going to do an overview of the nervous system, which is the central nervous system composed of the brain and the spinal cord. Then we have the peripheral nervous system, which is your cranial nerves, your peripheral nerves, and then your pathways, which is your afferent pathways. It's the ascendant pathway, meaning sensory to the spinal column, and then we have the efferent pathways, and descendant innervation to the effector muscles. The afferent pathway, basically, we take information from the body up to the brain. The efferent pathway, we take information from the brain down to the body to elicit whatever response we need. Okay? We'll talk a little bit about those. Then we have the peripheral nervous system, which is made up of the motor and sensory pathways, which regulates the voluntary motor control and of the skeletal muscles. We're also going to talk about the autonomic nervous system, which is made up of your sympathetic and your parasympathetic nervous system, which is your rest and digest and fight or flight. We're going to talk a little bit about how these impact your patient from a neurological aspect. Again, here we kind of summed it up a little bit. It says it's important to know neuroanatomy. Most of the neurological pathological process produce signs and symptoms that are consistent with the functional anatomy. Again, knowing the functional anatomy, you can basically depict different signs and symptoms. Now, what we're going to review in neuroanatomy is the basic neuroanatomy. We're not going to go into the intricate aspects of neuroanatomy. That would take a very, very long time. What we're just going to do is really like a crude overview of neuroanatomy so you can have a basic concept. You can just basically conceptualize what's going on with the patient based on crude signs and symptoms that the patient may display. Okay, so again, we're not going deep into basic taking apart the brain and taking apart the cells of the brain and stuff like that. We're just basically doing a really crude overview so that you can understand the basis of neuroanatomy. Okay, we're going to start first with the cranial vault. Okay, and the cranial vault is made up of frontal bone, parietal bone, occipital bone, and the temporal bone. The frontal bone here in pink covers the frontal lobe. Okay, the parietal bone here in gray covers again, the parietal lobe sits underneath it. Then you have the occipital bone here in blue, and the occipital lobe sits underneath that. Again, we're looking at this from a coronal view, actually from a side view, not a coronal view. Coronal is to back. So you're looking at a side view of it, and this side view basically is just a crude view. You can look at it from the front, you can look at it from the side, and then you can look at it basically from top to bottom. We're looking at it from the side. Okay, so this is a sagittal view of the brain. Okay, we can look at a coronal view where we look from front to back, and then we can look at an axial view where we cut it from top to bottom or bottom to top. We're just looking at an axial view, a side view of what we're of the brain or the cranial vault. Okay, again, The temporal lobe sits down here in this pinkish color. The occipital lobe is the back. The parietal lobe is the middle here. The parietal bone, I'm saying, and that's the lobe. The lobe sits under it, but these are the bones we're talking about. And then we have the frontal bone, which sits here in pink in the front. Okay? We have the sphenoid bone. The sphenoid bone, if you turn the brain over and look down into it, the sphenoid bone almost looks like a bat wing. And that's where the pituitary gland sits. There's the sella turcica under there, and the pituitary gland sits there. Okay? So when we're discussing the brain and we're discussing neuroanatomy, it's really essential to understand that there is neuroanatomy, which when we're talking, there is real estate, and then there's plumbing. Now, we can have plumbing without real estate, but it doesn't make sense. And then we can have real estate without plumbing, but that really doesn't make sense. So in order for us to, or for society to function properly, we have to have a good integration of the real estate and the plumbing. Brain works the same way. We have the real estate, which is the cerebral hemispheres, the cerebellum and the brainstem. And then we have the plumbing, which is the vascular system that supports the brain. Now, the vascular system is very important. The brain, if you have ever seen it anywhere displayed, and they call it actually the selfish organ. It is the selfish organ because it demands constant blood supply. It is not like certain organs where you can have limited blood supply for a long time and then it regenerates. The brain tissue requires constant supply of blood flow, okay? So without the plumbing, the cerebral hemispheres will die. And if the plumbing is not adequate, the cerebral hemispheres potentially die again. So we need a good integration of the plumbing and the cerebral hemispheres, or the real estate, okay? Now, when we talk about the real estate, we're going to be talking again about the cerebral hemispheres, the brainstem, and the cerebellum. And when we talk about the plumbing, we're going to talk about the cerebral vasculature. Now, I want you to conceptualize this. Now, we live in Miami, so think about various societies. And those societies, we have more affluent societies and less affluent societies. So I want you to think about societies such as Brickell. Now, if a pipe breaks in the middle of Brickell, it is considered an emergency. Or maybe Miami Beach is considered an emergency. People rush to get that fixed, okay? Now, if a pipe breaks in, let's say, Liberty City, or a less affluent neighborhood, then what usually happens is it's usually a slow process to get that fixed. And that's because we have what we call prime real estate and not so prime real estate. And then that's actually factual, whether we want to admit it or not. The brain is the same way. We have patients who come in and they have a stroke and they're devastated. And then we have another patient that comes in and have another stroke and they're not so devastated. The patient who's devastated probably hit prime real estate. They knocked out some part of Brickell, okay? And the patient who is not so devastated kind of walked out and they hit a little bit of Liberty City. The brain has prime real estate and not so prime real estate. And it depends on what's hit. So we're gonna talk about those areas. We're going to talk about the different aspects of the brain and what area of the body that part of the brain controls, and what we do in our daily life that require that part of the brain to function adequately. And so we're going to go from there. Okay. So looking at the neuroanatomy again. We're going to talk about the cerebral hemispheres. We have two cerebral hemispheres. We're going to talk about the different lobes of the brain. We have the frontal lobe, the parietal lobe, the occipital lobe, and then we have the temporal lobe. We have the cerebellum, which if you look at a structure of the brain, it almost looks like a next brain, a little brain stuck to the back of the brain there. And then we have the brainstem, which joins the brain to the spinal cord. Okay? So these are the two cerebral hemispheres. We have a right cerebral hemisphere and a left cerebral hemisphere, okay? Remember, the right hemisphere controls movement for the left side of the body. The left hemisphere controls movement for the right side of the body, okay? Now, there are other little intricacies that we need to really understand. Handedness. If you ever read a neurological report, whether it's from neurosurgery or neurology, it is very important when they have a lesion in the brain to depict handedness. They would say something like, this is a 54-year-old right-handed male, or this is a 54-year-old left-handed male. Now, why is it so important in when we're discussing a neurologically ill patient to describe handedness? Well, this is why. Because in all right-handed people, there are left brain dominant. So in right-handed people, the left side of their brain is a dominant hemisphere. In left-handed people, the majority of them, the left side of the brain is also the dominant hemisphere. But there is a few, it's actually less than 10% of the population that has a dominant right hemisphere, okay? And it's very hard to depict whether they're right brain dominant or left brain dominant. Now, there are a lot of things that people say, oh, that person is artistic, they can just play the piano, they're definitely right brain dominant. Not necessarily so. The only way you can depict handedness, or actually you can depict which hemisphere is dominant is in a left-handed person is through pathology. Remember, all right-handed persons are going to be left brain dominant anyways, but the left-handed person is where we're going to have to question. And when we try to figure that out, we're going to go by the speech centers. Now, we have two speech centers. We have a motor speech, and then we have a comprehension or receptive speech. The motor speech and receptive speech are the two speech centers, Broca and Wernicke's, and they're located in the dominant hemisphere. Now, your speech center is always in the dominant hemisphere. So for those less than 10% of the people who are left-handed and right brain dominant, their speech centers are going to be in the right hemisphere. Okay? The rest of the left-handed world, they're going to be like the right-handed people and have their speech center in the left hemisphere. Okay? So how do we know? Well, this is a situation. Tim is a 56-year-old male that comes in complaining of sudden onset difficulty speaking. According to his wife, they were having a normal conversation, and then all of a sudden, it's like he could not say what he wanted to say, okay? Tim happens to be left-handed, okay? He also has weakness of one side of his body. So when he comes in, remember we said that the left hemisphere controls movement to the right side of the body, and the right hemisphere controls movement for the left side of the body. Now, he's left-handed, he comes in with speech difficulty, and he also comes in with weakness on the left side of his body. So if the weakness is on the left side of his body, we know that is something in the right brain. But what's going on? Tim has speech difficulty. Remember, we just said that the speech centers are always in your dominant hemisphere. So if the speech centers are in the dominant hemisphere and he's having left-sided weakness, that means his right hemisphere is the dominant hemisphere. That's how you know. That's the only way you know, through pathology. Something has to go wrong for you to actually figure it out. Unless you do some kind of functional MRI or stuff like that, that can actually tell you these things. But on a normal day-to-day basis, you won't really know just based on what the patient's doing or what the person does, okay? Or how artistic that person is. You never know, okay? So these are not the things that determine that. So I wanted to point those out, why it's so important to know handedness, okay? Also, again, remember, the left side of the brain controls movement for the right side of the body. The right side of the brain controls movement for the left side of the body, okay? Now, this is what we were just talking about, left brain versus right brain. Now, the left brain is your analytical brain. Okay? This is where all your analytical processes take place. This is where your thinking, reading, writing, arithmetic, sequential order, mathematics, all that is housed in left brain. The right brain is more of the spatial awareness, art appreciation, recognizing faces, all that is housed in the right brain, okay? So if you look, we have to have a nice even balance of left brain and right brain, okay? We have the analytic brain, and then we have the artistic type of brain, which is your right brain, okay? Now, before we actually break apart the cerebral hemispheres, we're going to start from the top. We talked about the cranial vault. Now, beneath the cranial vault are the meninges. And the meninges are made up of, there are three meninges: the dura mater, the arachnoid, and the pia mater. Okay? The dura mater is the outermost layer. It's actually called tough mother. It's the most tough. It's like a leathery type of layer. And it's the outermost layer of the brain. Okay? Then you have the arachnoid layer, which is the middle layer. And then you have the pia mater. The pia mater is really closely adhered to the brain, and it follows the brain in the gyrations wherever they go. Now, with the dura mater, above the dura is the epidural space. Below the dura is the subdural space. So if you hear someone say you have a epidural hematoma, know that it's between the cranial vault and the dura. Okay, it's not under the dura, between the cranial vault and the dura. Okay, if you hear someone have a subdural subdural hemorrhage, it's beneath the subdural layer, okay, and above the arachnoid layer. Now, if someone has a subarachnoid hemorrhage, it's actually beneath the arachnoid layer and above the pia mater, okay, or above the brain. Now, the pia mater is actually, it's really hard to peel it away. It's actually tightly adhered to the brain, and it follows the brain and the gyrations wherever they go, okay? Now, here is a nice depiction of it. You see, this is the cranial vault right here. I'm going to use my hand because it's probably easier to see, okay? Right? And then, after that, then you have the dura mater. It's that thick, fibrous layer here, okay? Okay? And the dura mater has some separations, and these separations are the venous sinuses. And the venous sinuses is where the arachnoid villi come up and they reabsorb CSF, okay? Now, in the arachnoid space, you have a lot of vessels in the arachnoid space. You have arteries and veins. The arachnoid space almost looks like a spider web type layer. That's why they call it arachnoid, okay? And it's the second layer, okay? In the arachnoid space, we have the vessels, and again, when they rupture, they can cause subarachnoid hemorrhage, okay? Below the arachnoid space. And then you see the pia mater. If you look at the pia mater, in here in pink, it follows the brain in the gyrations wherever it goes, and it tightly adheres to the brain. You can't feel like or see any potential space beneath it, okay? If we have a subarachnoid hemorrhage, it's usually in this area. It's usually a rupture of a vessel. In the subdural space, we have what we call bridging cortical veins, and these are what rupture when we have a subdural hematoma. And in the epidural space, we have the middle meningeal artery that comes up right by the temporal bone area that actually is what is ruptured when we have a epidural hematoma. But we'll talk about that a little bit later. But if you look at the structures, you'll know. We have a subdural, we have an epidural bleed. It's a gap between the dura and the cranial vault. And again, what is epidural bleed? It's an arterial bleed. It's the middle meningeal artery that's lacerated. Then below the dura is the subdural space. We have bridging cortical veins in the subdural space, and then there what's ruptured with a subdural hematoma. Then below the subarachnoid space, the subdural or the dura, we have the arachnoid layer, and then below, in that potential space, below the arachnoid layer, is a subarachnoid layer, or a subarachnoid space. And we have some vessels in there, and again, it looks like a spider web-like layer, and this is where we have your subarachnoid hemorrhages, and then we have the pia mater, which doesn't have any space below it because it's tightly adhered to the brain. Okay. This is another diagram of the brain that shows you where the different lobes of the brain are. The frontal lobe is in the front. Okay. You have the corpus callosum, which is right here, which actually separates or transmits information between. We have the temporal lobe, which is on the side. Okay, it's another axial cut. We have the cerebellum. Again, it's like another little brain that sits behind. We have the brain stem, okay, which is made up of a midbrain, which is here. This is the pons, or what we call pot belly, and then this is the medulla, which is the last part. Okay. So you have the top of the brainstem, which is the midbrain, then you have the pons, and then you have the medulla. Midbrain, pons, medulla. Okay? Cerebellum, you have the thalamus, which is this area right here. You have the parietal lobe, which is in the middle. Okay? You have the sensory strip, which is the back of the frontal lobe. This is the space here. This is the back of the frontal lobe, where you have the motor strip, which actually sends information down to innervate to have motor movement, and then sensory strips, which actually interprets what sensation that you're feeling, pain, temperature, all that. And then you have the reticular formation, which actually is responsible for awakeness and alertness. Okay, you have the hypothalamus, which sits below the thalamus, and the hypothalamus is almost like the integration between the brain and the endocrine system. Releases a lot of hormones that activate areas or send signals to different areas of the body. Okay, you have the limbic system. I always tell my daughter, when she was a teenager, I used to tell her this is the part of her brain that actually makes the decisions, because the limbic system is actually responsible for emotions. So when you hear someone say you're using your limbic system instead of your frontal lobe, remember your frontal lobe is executive function, your limbic system is emotions. So if you're thinking with your limbic system, you're an emotional thinker rather than a executive type of thinker with your frontal lobe. Okay, so another diagram. I'm not going to go into this, but you can take a little time to look at it. We'll talk about the different areas and where they innovate. I think that's actually the last one, the last diagram that we have. Okay. Okay. So the left hemisphere. We said that the left hemisphere, for most people, is the dominant hemisphere. Okay. And it controls movement for the all right-handed people. The left hemisphere is dominant. Okay, it is responsible for reading, writing, arithmetic, reading, sequential order, science. All your analytical thinking is housed in the left hemisphere. Okay, and movement for right side of the body. Now your right hemisphere, it's a non-dominant hemisphere in the majority of people. Spatial awareness, art appreciation, religion, remembering faces, imagination, art appreciation, spirituality, not religion but spirituality, and control for the left side of the body. Okay. Now, we're going to talk about the different lobes. Okay, we have the parietal lobe. Parietal lobe is that middle lobe that we talked about when we looked at it. If we look at it here, your parietal lobe is this middle lobe here. Okay, we have the frontal lobe here, and then the parietal lobe here. This is almost an integration. It's a sensory integration lobe, and it actually is home for the sensory cortex. And it actually is what interprets pain, heat, other sensations in your parietal lobe. So your parietal lobe is more of a sensory type lobe. Okay, it's home for the primary somatosensory area. That's what I showed you, that area in the front of the parietal lobe. Okay, and it allows for recognizing familiar objects. When you actually hold an object in your hand and you can recognize it, is nausea, agnosia is the inability to do that. That is all housed in parietal lobe. Now, someone who comes in with a parietal lobe, a right parietal lobe injury, usually they have left-sided neglect. Okay, usually they don't recognize the left side of the body. Someone who comes in with a stroke and you notice that they don't recognize the left side of their body, most likely it's a right parietal kind of injury. It's usually like a stroke or something in the parietal lobe. The occipital lobe is your visual cortex lobe, and it's actually responsible for visual perception. Remember, the retina takes in the light reflex and it actually transmits back to the occipital lobe for the occipital lobe to interpret whatever the light is, and then it actually can formulate what you're seeing. Okay, so it's a very quick process. As you think, the light reflex comes in, it goes back to the occipital lobe to interpret what it is, and then your brain actually can conceptualize what you're seeing. Okay. The temporal lobe, primary auditory lobe, processes information. It's actually where the receptive speech center is. The Wernicke's area is where your speech interpretation is. Wernicke's area is understanding speech. My Broca's area is firing at 100,000 times per minute, and my Broca's area is the expressive speech. And expressive speech is housed in the frontal lobe. Receptive speech or understanding speech is housed in the temporal lobe, where Wernicke's area is. That is actually how you can actually interpret what the spoken word is. Okay, so receptive, expressive speech, my Broca's area, firing at 100,000 times per minute. As I am expressing to you what I'm saying, your Wernicke's area is firing at 100,000 times per minute because you're understanding what I am saying to you. Okay, so the comprehension aspect of speech is housed in Wernicke's area. Wernicke's area is housed in the temporal lobe. Okay. Now the frontal lobe is the initiation for motor activity. The motor strip is in the back of the frontal lobe that we talked about. Executive function, planning, okay? So learned social behavior. That's one of the most important, one of the things that we see a lot. That patient who is, has no inhibitions whatsoever. They'll walk down the hallway completely naked. Okay, that's the frontal lobe injury. Someone who is not behaving like they normally do, or has no inhibitions, or is severely depressed, or laughing inappropriately, sometimes that's frontal lobe injury. Okay, Broca's speech or Broca's area is housed in the frontal lobe. Again, that's expressive speech. That's me firing 100,000 times per minute here. And again, home for the primary motor area of the cerebrum. That's in the back of the frontal lobe, right in front of the parietal lobe. The back of the frontal lobe is the motor strip. In the front of the parietal lobe is the sensory strip. The motor strip innervates motor in the body, and the sensory strip innervates and interprets motor sensations, and then the movement, I should say, and then the sensory strip interprets sensation, pain, heat, temperature, all that other stuff is in the parietal lobe. Okay. Now, deep in the brain, you have the basal ganglia. The basal ganglia is made up of a caudate nucleus, a globus pallidus, and a putamen. These are the three little areas that you see here. The basal ganglia is responsible for motor sensation or motor movement. This is what's implicated in things like Parkinson's disease. It's responsible for Parkinson's, Huntington's disease, are all implicated due to injuries in the basal ganglia. Okay. Again, globus pallidus, putamen, and caudate nucleus. programmed or automatic movements, again, implicated in Parkinson's disease, Huntington's disease, movement disorder diseases, or are implicated in the basic ganglia. The thalamus is actually responsible for signaling and relaying prioritization. It's the central relay station for the brain. Sensory impulses that come up from the body go through the thalamus and then go through the sensory cortex. Information from the sensory cortex is sent through the thalamus, then back down to the body to elicit a response. Okay? Modulates arousal, maintains alertness, and directs attention to sensory events. The hypothalamus, again, this integrates the central nervous system with the endocrine system. It actually controls temperature, hunger, thirst, circadian rhythms, and this is usually implicated through hormones or messengers that are produced in response to various needs that the body may have. The cerebellum is some people call it that little brain attached to the brainstem. It's in the back of the brain. This is made up of a number of nerve fibers called peduncles. And if you look at it, it's like this little, almost like these little ridges that you see on the cerebellum. It actually controls coordinated movements. So people who don't have coordination, sometimes you look towards this cerebellum. Ataxia, dysmetria, those types of things are regulated by the cerebellum. So equilibrium, motor tone, balance, okay? When you're testing Romberg, when you're testing finger to nose to finger, you're testing the cerebellum to look for coordinated movements. The brainstem, this is almost like brittle territory here. It is made up of a small midbrain, a pons, which is like we call pot belly, and the medulla. Most of your cranial nerves are housed in the brainstem. There are only two cranial nerves that are housed in the cerebral hemisphere. That's cranial nerve 1 and 2. We'll talk about those in a little bit. But every other one is housed in the brainstem. Okay? So the midbrain, in integrating visual and auditory stimulus, it's home for cranial nerves 3 and 4. Okay, because we said 1 and 2 are in the cerebrum. Then we have the pons, aka pot belly. Coordinates length of respirations, and it's home for cranial nerves 5, 6, 7, and 8. Okay? The medulla is the last portion of the brainstem. It actually attaches the brainstem to the spinal cord. It is home for cranial nerves 9, 10, 11, and 12. Okay? It controls vasomotor activity, respiratory, vomiting center, cardiac center is located in the medulla. Deals with autonomic functions, breathing, heart rate, blood pressure. It is very important in sustaining life. If the medulla is compressed or it's not functioning adequately, imagine not having vasomotor centers working, cardiac, respiratory, blood pressure, autonomic functions, breathing, heart rate. Imagine all that being disrupted. This is definitely a brittle area that you don't want to be disrupted. You don't want blood flow to not go to that area. Okay? I'm not sure why we have the cerebellum twice, but we just already spoke about this, so we're going to move on. Now we're going to move on to the ventricular system of the brain. And we're not talking about the ventricles of the heart, we're talking about the ventricles of the brain, okay? We have two ventricles, one in the right hemisphere, two lateral ventricles, one in the right hemisphere and one in the left hemisphere, okay? If you look at a brain structure, you'll see that area, it's almost, on CT, it's like a dark area, and that is the CSF that you're seeing in the middle of the brain, okay? And the ventricular system is made up of lateral ventricles, one on the right and one on the left. You have the foramen of Monroe, which connects the lateral ventricle to the third ventricle. Okay, CSF is made in the brain. It's made in the lateral ventricles, and is actually secreted. what you would call it,